everyone, Jackie from Active Health Clinic. I'm coming to you today to talk about anxiety versus POTS. Now, I know too many of you have been through, whether it be months or years, of that saying from health and medical practitioners. Have you been told it's just anxiety? I know so many of you have, and it is so frustrating. And I think the most important thing to understand is that POTS does look like anxiety because it uses the same system, and that's what I'm going to talk to you about today. So if you have been experiencing POTS for a short or a long period of time, you will have had episodes that you have noticed it does feel like anxiety. And you can be a little bit unsure of going, well, is this a POTS related sensation that I'm having, or is this actually anxiety? But majority of the time, if we know that you're not an anxious person or you've had a history of anxiety, we can be pretty confident, and I want you to be confident that it's not anxiety. It's actually your POTS and your body's way of communicating with you, okay? But I know over time, you've just been in this head spin, okay? Now, the reason that you feel periods of anxiety when you are not really anxious is because the body uses the same system to encourage blood flow return to the heart and the brain so you don't faint. But this can also happen when you have been sitting for too long or standing for too long. So when you're feeling anxious and scared, your body releases stress hormones being adrenaline and cortisol. Adrenaline helps your body react really quickly, and it makes your heart beat faster. It increases blood flow to the brain and the muscles. And that's a survival mechanism because obviously we don't want to faceplant the floor. An adrenaline rush begins in the brain. So when you perceive a dangerous or stressful situation, that information is sent to the part of the brain called the amygdala, okay? This is the area of the brain that plays a role in our emotional processing. So hence why anxiety activates this area as well, okay? So if danger is perceived by the amygdala, it then sends a signal to another area of the brain called the hypothalamus. And the hypothalamus then is the command center of the brain. It's where our fight, flight, freeze, faint mechanism sits. And as you will have all learned in your journey, if you have started and been going through the program with us, is that we talk a lot about this sympathetic overdrive, and that's that command center that is in a much more heightened state, okay? So the hypothalamus transmits a signal where the adrenal glands respond by releasing adrenaline into the bloodstream. Now, whether this be postural related or it is a vicious cycle of you're feeling anxious about the sensation of anxiety when you know that you're not actually anxious. So often patients will often have a bit of a chuckle when we say, well, you get anxious about feeling anxious when you're not anxious, and then it just spirals that vicious cycle. So what tends to happen is that the two systems they work interchangeably. So because of the release of the adrenaline, you will start to notice that you get an increase in heart rate. You might start to sweat a little bit. You'll get some, racing thoughts, cloudy thoughts, and it will start to feel very uncomfortable. But what can happen is that if you have actually been sitting for too long with your feet down on the floor like I am now, if the blood pools in our legs, the brain will start to detect that there's not enough blood flow getting back up towards the heart and the brain, not enough oxygen circulating through our lungs. And what the brain will do is it's, again, going to communicate with the body and send that signal to release adrenaline so that we get constriction in the blood vessels and an increase in heart rate to bring the blood flow back up to the brain, okay? We can also get this if we are standing still for too long or we are upright for too long. So a common experience that patients will often describe is that they've been sitting watching TV, or they're standing in the line at the supermarket, and all of a sudden they've started to feel anxious. And because of the way our fight or flight system is tuned and ingrained into our brain from evolution, is our biggest action is to fight or flight. It's like, well, I need to get out of here, I need to get home, or I'm feeling really uncomfortable, something needs to change. But what I'm here to tell you about today is that in that moment of feeling that sense of anxiety, I want you to be able to, in that moment, have a think about, is this a stress response? Such as we usually say, well, is it I'm scared of spiders? There's something on your mind. There is actually something that you're feeling anxious about. Or is it postural? So in that moment, I'm feeling anxious, but you're just sitting there watching a TV show. And if it's not a scary TV show, or it is provoking any sort of emotion or trauma or memory, then I would just be looking at, I've been sitting with my feet down for too long. Sit back, pop those feet up onto the footstool, take a few deep breaths and allow the body to resettle through that, okay? What you might also need to do is that the body might be communicating to say, we need to get up and move. So you've had that adrenaline release into the bloodstream, and sometimes sitting there with it might not be very comfortable. So this is where you might get up, you might go walk to the kitchen, grab a glass of water, have a bit of a walk around the house, go outside, get some fresh air, come back and watch your TV show. So essentially what I'm saying is that it is really important to know the difference between what is anxiety and what is postural related. So hopefully that has helped in terms of understanding that anxiety and POTS, so again, uses the same system. The goal is the same. It is about increasing blood flow to the brain and to the muscles. So if we were in an unsafe situation, the goal is to fight or flight, to survive. But from a postural point of view, it is just about making sure that we don't get too much blood pooling in the legs, and we want to get blood flow back up to the heart and the brain so that we don't faint. So hopefully that helps, and you will have a little bit more of a better understanding of what your body is trying to tell you when you have that anxious type feeling.